Philadelphia, Pennsylvania. First off, good morning, Dr. Mike, and I have to say you are really becoming a fan favorite here on NewsNOW from Fox.
Have you been talking with my mother, Rain? Have you been?
I haven't been talking to your mother. Is she also a fan favorite of yours?
Look, if your mother doesn't love you, I mean, what are you going to do? No,
Yep.
I love my
lot.
mother.
That says a lot. All right, let's jump right into it. So we're hearing about some really big news when it comes to the Johnson & Johnson vaccine that's happening today. What's going on, Dr. Mike?
Basically, what's happening today, remember earlier in the week, the FDA endorsed the Johnson & Johnson vaccine for COVID-19. Today, the advisory panel, these are a group of experts that are all about vaccines. They're going to get together, get in a room, close the door, and stay there until about 5 o'clock today. And I guarantee you, unless there is some cataclysmic problem, they are going to advise the FDA that they should approve this vaccine, the Johnson & Johnson vaccine, for emergency use authorization. Then what's going to happen, I predict, tomorrow, the FDA will approve it, and they will start shipping this stuff out, up to 4 million doses, hopefully by Monday. That's my prediction.
Hopefully by Monday. Okay, so Dr. Mike, walk us through the process of the approval. How long does this normally take? Will they decide by today and then by Monday we'll get the vaccine?
Well, look, we're in the middle of a pandemic right now, Rain. We don't have a lot of time to waste. All of the vaccines, this will be number 3 that will hopefully be emergency use authorized. Remember, we had the Moderna and the Pfizer vaccine went through the same process. Normally, before a pandemic, it would take 10 years for a vaccine to get official approval. Remember, this is not official approval. This is emergency use authorization. And what they're going to do is they're going to look at the data very carefully to see if it is safe and effective. And all indications are that this vaccine is both. And we will then get the FDA to grant this emergency use authorization, I predict tomorrow, and we'll get going. If you're a military history person like me, this is kind of like Bastogne in World War II. We need tank support. We need air support. We need everything because this virus is a nasty thing and we need to, we're in a race with it. The more people that get vaccinated, the quicker this virus will be negated and shut down, and we'll be in a much better place.
Now, Dr. Mike, is there anything that stands out to you about the Johnson & Johnson vaccine? How is it different than the others?
Well, Rain, it's a different type of vaccine. It is a viral vector vaccine. Now, this uses a harmless adenovirus that has been made null and void, if you will. It's not a messenger RNA vaccine like the other two. Now, what's great about this is that, number one, it is a single dose. Number two, it can be stored in regular refrigerators like ones in my office and doctors and nurses' offices across the country. And number three, it seems to be effective against these nasty variants that are coming about. So there are a lot of good reasons that this thing is coming along, and this is going to really add to our armamentarium of vaccines to get to the people, to outrun this virus and make it something that we look in the rearview mirror at.
You seem very confident about the vaccine, but I just have to mention a lot of people are still hesitant for so many different reasons. Are there any warnings or specific groups that maybe should do more research before getting this vaccine and others?
Well, certainly if you have a history of severe anaphylactic reactions to anything, you really need to talk with your healthcare provider. You might need to see an allergist. The Centers for Disease Control has set up 3 categories. There's those that are contraindicated in getting this type of vaccine, those that need to take special precautions. Those are folks who have had any kind of severe allergic reaction to another type of vaccine in the past. leading to like an anaphylactic reaction, those are the folks that need to probably see an allergist first or be observed for 30 minutes. And then for the rest of the folks, even if you have an egg allergen, no egg in the Pfizer Moderna vaccines, but you know, you have to watch and know what precautions you need to take. So with any of these vaccines, you're going to have to check with your healthcare provider if you've had any kind of serious allergic reaction. And that goes for all three of them. Okay?
Really, really good to know. Dr. Mike Cirigliano, final thoughts.
We're in a race. A lot of people, Rain, are saying, Dr. Mike, I think I'm going to wait and get this vaccine over that one. No. Run, don't walk. If you get the golden Willy Wonka chocolate factory ticket and you are lucky enough to get a vaccine, you run. You don't walk, you run to get it. They are all effective, they're all safe, and with this amount of armamentarium, I see light at the end of the tunnel. We've got to outrun these variants, and we may need boosters down the road, but the sooner we get people vaccinated, the sooner we will get out of this mess, Rain.
Thank you so much. Always such a pleasure to have you here on News Now. Thank you.
You take care, Rain.
All right, now President Joe Biden